Thank you very much, dear Chairman, ladies and gentlemen. I'm going to present our experience with advanced transanal irrigation. These are my affiliation to disclose, and defecation disorders are very common in children, and a minimal part of this one are related to organic or neurogenic dysfunction. And the treatment has been often empiric in the past, and thanks to transanal irrigation, we have standardized the treatment of these patients. And the treatment with a transanal irrigation is now a diffuse practice in many pathologies as spina bifida, anorectal malformation, Hirschsprung disease, and cerebral neurogenic bowel to cerebral palsy and functional disorders. And the treatment is recommended in the recommendation of ICI, and in the literature we have several studies. The majority of them, all of them, are reported to the Peristeen device. Otherwise, the improvement on quality of life and bowel function is very high, but there is a lack of efficacy in a high percentage of patients, and the drop-off is still a serious problem. And in many cases, the reason for cessation include the mechanical problem, but in other cases, there are the parental or patient compliance. And in order to define the role of training and follow-up, we have evaluated our population, and we have included patients that we have treated by 2009 to 2018, and we have used the same criteria for the different devices that we have used. The majority of patients were treated with Peristeen, but we have also a small amount of patients with Navina Smart, and we have trained patients that we have in the follow-up in our center as patients that were referred to our center due to the lack of therapists, specialized therapists in their center. In Italy, we have more or less 60 centers of pediatric surgery and pediatric urology that treat neurogenic bowel, but only in the 50% we have specialized therapists. And so it's common that tertiary center, as our center, receive patients from other centers for training, either for CIC, either for the transanal irrigation. We have evaluated the bowel function, we have evaluated the quality of life, and not all the patients were answered to our questionnaire and our interview, and the drop-off was higher, and it was higher in both populations. But comparing the results, we can see a bowel function that ameliorated in patients, and as well as the stools type, and the satisfaction was high. The dropout was reduced in our series, and the satisfaction was higher, and either the satisfaction. And the difference, in our opinion, was related to the fact that we have the opportunity to do a care follow-up with these patients respect to other population, because they have, all of our patients have every 2 months a control. And it's not possible to compare the two systems because, as you can see, the numbers are completely different. And the consensus reviews that we have produced for a best practice of transanal irrigation in children is very useful. We can receive in these best practice a lot of indication for training, troubleshooting, solving, but otherwise, one of the major concerns remaining the need of more expert nurses and therapists for a correct training, and also to define maybe to improve assistance in order to reduce the drop-off rate. Thank you very much.
Questions? I have a question for you. What did the training consist of given to the parents?
Yes, so we have a 3-day module, and we have generally we perform with the outpatient clinic. In some cases, we perform inpatient clinic with patients that are very far from our hospital. And during these 3 days, and the first day, normally the therapist started with the irrigation, and showing the methods, and then the other 2 days the caregiver perform by themselves. And normally then we have every 2 months a control. And the concern that we observed, of course, with the patients that are in follow-up in other center, that we have performed the same training, but we haven't performed the same follow-up because they are in the care of other center. And was significant the results between the two populations. And maybe, in our opinion, this one could be a point where we need to work in order to guarantee the same care for all patients. And as I told you before, we know it is a solution to increase the number of expert nurses and expert therapists that is very lacking in many centers of Italy, that more or less is the same for the clean intermittent catheterization. But it's a nonsense that we receive patients that need a training for clean intermittent catheterization, transvaginal irrigation, and then they come back to their center. Then, of course, they don't receive the same follow-up that can receive in a center where there is possible to check what you are doing at home every day with your nurse.
Question?
Ahmed Zahrani from Saudi Arabia. Are these patients failure of medical therapy, or straight away you go to transanal irrigation?
No, thanks. For all the patients, we use the pyramid that I showed you and that we have elaborated. And this is always a treatment that we perform where we have no response to a standard treatment. And the discussion could be if we can consider transanal irrigation now a second level treatment or a first level treatment, because the advantage of transanal irrigation, in my opinion, that thanks to these methods, we have standardized the approach to constipation, that before the use of this advanced system was very, very empiric. We have seen in many cases that now it's common that they perform a regular diet, a fluid amount, physical activity, and also supplementation that before we don't perform. So I think that the methods is a real advantage, it is in my opinion, because we have reduced dramatically the number of Malone procedures for treatment of this patient. We have reduced the requirement for neuromodulation for other invasive procedure, but otherwise the great advantage that we have standardized the approach of these patients that was before very, very empirically.
Thank you.
Thank you very much.
Thank you very much.